Great. Good afternoon, everyone. We're going to give it just a few more minutes so that folks can join, and I'll get us started in like 4:02.
Hello, this is your.
Okay, I see a question. We haven't started yet. We're giving it a little bit over a little less than a minute. Waiting for some people to join, for more folks to join. Okay, great. Thank you everyone for joining us today. Before I begin, I want to do a few housekeeping notes. And then I also want to take this opportunity to thank Pfizer for their generous support for our Vaccine Equity Project and for making this webinar possible. In terms of the housekeeping note, we will have a Q&A session at the end of the presentation. So I ask if you have any questions, please feel free to write them in the chat or the Q&A box. We'll get to them at the end of all of the presentations. And then also we do have sign language available that is set up. It is our first time, and so we're figuring it out as we go. So thank you all. Next slide. Okay. Then my name is Yadira Montoya, and I am the Programs Director at the National Alliance for Caregiving. The National Alliance for Caregiving is one of the leading organizations focused on shifting systems to address the unmet needs of caregivers, of family caregivers. We do this through a national coalition model, which includes corporate and nonprofit organizations representing different sectors of society, including pharma, managed care, patient advocacy, caregiving, and aging organizations, among many others. We bring folks together around initiatives in policy, research, and programming to build health, wealth, and equity for the 53 million caregivers living in the US. One of the critical components of building health for caregivers is raising awareness about, sharing resources and information, and discussing how pressing health issues are impacting caregivers and those they care for. So today, we have several speakers lined up to provide critical information about why the COVID-19 virus is still a threat, how vaccines continue to protect us and to be covered and available in our communities, as well as information and resources with specific relevance to caregivers, older adults, and disability communities. Next. To start off, I want to introduce our first speaker, Lindsay Clark. Lindsay Clark is the Senior Vice President of Health Education and Advocacy at the Alliance for Aging Research. As the head of the Health Education Department, Lindsay oversees all aspects of developing and executing the Alliance health education products, from funding to dissemination, focusing on age-related health conditions, diseases, and issues. Lindsay has created and overseen dozens of award-winning educational films, the well-respected Silver Book series on the burden of chronic disease, the Our Best Shot campaign that's focused on increasing vaccinations in older adults, patient brochures and toolkits, healthcare professional resources, expert consensus on white papers, patient websites, and countless other educational material. As the Senior Vice President, Lindsay is also involved in the strategic planning and execution of the Alliance missions and goals. She oversees a number of interdepartmental and operation-focused projects, leads the Alliance Board Governance Committee, and assists in drafting of various policies and procedures. Prior to the Alliance, Lindsay was an attorney in Chicago and worked for the Chicago-Kent College of Law as a director of institutional projects. She earned her Juris Doctor degree from the Chicago-Kent College of Law and her bachelor's from the University of Michigan with a concentration in biology. So with that, I turn it over to you, Lindsay.
Thank you so much. Had I known you were going to have to read all of that, I would have sent you a shorter version. My apologies to everyone who's listening, but I appreciate the introduction. And just a quick intro to the Alliance, if you don't mind. Next slide, please. We are, for those of you who don't know us, we're a small nonprofit based in Washington, D.C., and we focus on using education and advocacy to achieve healthy aging and equitable access to care for everyone. And next slide, please. As Yadira mentioned in the intro, one of the campaigns that I lead as part of the Health Education Department is the Our Best Shot campaign. And we've been doing this campaign for close to a decade. And it's aimed at really helping to educate older adults about the importance of vaccines throughout our lives. I think there's obviously a huge emphasis on which vaccines our kiddos need. And we understand that, and especially mine do, that every time they go for a well check, they're probably due for a vaccine. But I don't think that we have the same understanding with older adults. So we produce dozens of resources on how vaccines work, which ones we need and when, where we can find them, et cetera. And we focus not just broadly on vaccination, but also on a lot of specific vaccine preventable diseases as well. And the resources we've produced over the years include animated films, personal stories, easy to access vaccine schedules, fact sheets, infographics. In fact, you'll see some of the infographics that we've created a little bit later on. And if you're interested in seeing any of this, you can find it all on our website at agingresearch.org. Okay, next slide. So what are we here to talk about today? Obviously, why it's still important that we're getting our COVID boosters, especially as we're preparing to gather with our friends and family for the holidays. So before you head over the river and through the woods to grandmother's house, be sure to make sure you're up to date on your latest COVID vaccine, obviously along with whatever else you're due for, your annual flu, maybe pneumonia, RSV now this year, so anything you're due for, but making sure you've got that latest COVID booster. The updated vaccines for COVID are recommended for everyone ages 6 months and older, and they're available at places you'd normally go to get your vaccine. So your healthcare professional's office, your local pharmacy, your local grocery store. And it's really important for us to remember that staying up to date with our vaccines is the best way to help not only protect ourselves, but our families and anyone that we're caring for from the worst outcomes of COVID. So I know we've all heard from someone who said, you know, I got COVID even after I got the vaccine. And that's certainly true. It's not preventing all cases of COVID, but these vaccines are proven to significantly reduce serious outcomes. And that's including hospitalizations, stroke, heart attack, long COVID, and even death. So it's incredibly important that we're staying up to date. Okay, next slide. So the good news is the vaccines are free. Shout out to Louisiana Department of Health, where I borrowed this image from. But important for us to realize that the COVID vaccines are required to be covered free of cost for children and adults. And this is regardless of your health insurance type or status. So there has been a shift since the ending of the public health emergency to traditional insurance. But even as those changes are taking place, those COVID vaccines should be available free of cost. So under Affordable Care Act, insurance companies are required to cover all the vaccines that the Centers for Disease Control and Prevention recommend. This includes the updated COVID vaccine. So if you are on private insurance, your vaccine should be covered with no out-of-pocket costs. And this is just a quick note, that's through in-network providers. So if you're having trouble, you might want to make sure that the provider is an in-network provider. Children without insurance can get their COVID-19 vaccine under the Vaccines for Children program. This also covers kiddos who are covered by Medicaid or the Children's Health Insurance program. And then anyone who's uninsured or underinsured can get their COVID vaccine for free under a program through the CDC called the Bridge Access Program. That's available at participating providers, health centers, and pharmacies. But bottom line, you should be able to get the updated COVID vaccine without a cost to you. All right, next slide. Have I lost you? Oh, good, thank you. So why do we still need them? I mean, I think it's like we're all experiencing COVID fatigue, and it's hard to remember and remind ourselves that COVID-19 is still very real. And so even though we're experiencing a lot of progress, it's still a threat to people of all ages, not just those that are immunocompromised. So staying up to date can help us prevent those serious consequences I spoke about a few minutes ago, but also can really keep us on track and helping avoid missing activities such as school or work. Hopefully, if anyone gets infected, you're staying home to protect others, and can mean a lot of time off of work or school. Next slide. All right, and this is just to remind us that even though you may have received, hopefully, a previous COVID vaccine, it doesn't mean you're protected now. So we do know that protection from the vaccines declines over time. And so that's why we need the boosters. And we also need to remember that previous infections can give us protection, but that protection also declines over time. Also not featured here, but it's important to remember that just because you were fine and didn't have a bad case of COVID last time you had it, doesn't mean you'll be fine this time. Reinfections can be much worse. And actually, I do have an infographic about that. So reinfections, you can see 2 times the risk of death, long COVID, and fatigue, and 3 times the risk of hospitalization, heart problems, and blood clotting from reinfection. So just because one time with COVID was okay, doesn't mean the next time will be. All right, next slide. So despite all of these things being true, we're still only seeing that about 1 in 5 adults have received an updated COVID vaccine as of mid-November. So we still have a lot of folks who need to find a time to get to their local pharmacy or to the provider to get a booster. All right, next slide. So why is this? I mean, clearly it's fatigue. We're getting a little bit tired of having to wonder when our next vaccine is, and that's understandable. You might be getting other vaccines like for the flu or RSV, but there's also hesitation still out there, and a lot of that is because of the continued misinformation that we're seeing. As you can see here, misinformation works. So a brief exposure, one study found that a brief exposure to misinformation, disinformation on COVID-19 vaccines caused willingness to go down by 6.4%. And that was a very brief exposure, like a quick look at something. We also know that inaccurate information is more likely to be shared than facts. I think sometimes it's, juicier to share the outrageous claim than the facts. And so there continues to be a lot of misinformation out there when it comes to COVID vaccines. Next slide. So I think we could spend hours looking at a lot of the misinformation that's out there, but just a few things to highlight. We know that COVID vaccines have been given safely to hundreds of millions of people and that serious reactions are rare. However, serious complications from COVID aren't. The good news is vaccines reduce heart attack and stroke risk by 41%. And that's huge. So it's a great reason to go out and get boosted. Next slide. And another way to look at this is by looking at the risk of developing blood clots. There was a lot of information going on around there about blood clot risk from vaccines. And again, serious side effects from the vaccines are rare. However, we do know that the risk of developing a blood clot because of having COVID goes up 22 times, and those can lead to heart attack and stroke. So there's serious risk of cardiovascular complications, and the vaccines are proven to reduce those serious consequences. All right, next slide. I'm wrapping up here. I just wanted to feature, if you're interested in getting more information, the Alliance, along with the National Caucus and Center on Black Aging and Healthy Women, we co-convene a large coalition of about 250 different groups that focus on raising awareness around COVID. So the beginning, we're looking at clinical trials process and regulatory review, and now we're really looking at what vaccines you need, when, and all of that. So you can check it out at covidvaccineproject.org. And I also wanted to really point people to vaccines.gov if you have any questions about what vaccines you need, if they're covered, and all of that. So that, I believe, is my last slide. Thank you so much for having me.
Thank you so much, Lindsay, and thank you for highlighting the different points of misinformation and disinformation that we see, as well as reliable websites where we can go find accurate and reliable information. So up next, we have Jennifer Hammer. Jennifer joined USA Aging in February 2023 as its Assistant Director of the Aging and Disability Vaccination Collaborative, ADVC, a national effort funded by the U.S. Administration for Community Living that focuses on vaccine uptake among older adults and people with disabilities. In this role, Jennifer serves as the primary liaison to national grant partners and supports the development, implementation, and evaluation of the project. Jennifer has extensive experience working with older adults in a variety of capacities, including senior move management, helping veterans and technology focused on helping older adults live well. She holds a bachelor's degree in English from Texas A&M University and a teaching certificate from Western Washington University. When she's not at work, Jennifer enjoys being in the outdoors with friends or cooking. Thank you. And with that, I'll hand it over to you, Jennifer.
Thank you so much, Yadira. And I'll echo, I didn't know you were going to have to read all that. So thank you for that. Really happy to be here. Thank you for having me. As Yadira said, I work for US Aging. And for those of you who might not know this organization well, we are a national organization that represents and supports the national network of area agencies on aging, and also advocates for the Title VI Native American aging programs that helps older adults and people with disabilities. So just a little bit about US Aging, and then the Aging and Disability Vaccination Collaborative. Next slide, please. Thank you. Was funded by a grant from the Administration for Community Living. So US Aging received $75 million to help older adults and people with disabilities specifically get flu and COVID shots, although other vaccinations are offered at many of the clinics that our grantees put on. So, and these vaccinations, they're through a wide variety of community events. Some of our grantees provide in-home vaccinations, mobile clinics, all kinds of really great great clinics that aren't clinical. And that's part of the wonderful thing about this grant, is it's allowing our grantees to really meet people where they are and have these accessible, sometimes very fun and creative clinics that really lower that stress level for caregivers, for the families they're helping, and everyone who comes. So they also offer supportive services such as transportation and appointment setting, and they do a lot of education and outreach. So just as we just heard, that is critically important to making sure everyone has the right information, and at the right time and in the right way. So next slide, please. So just a quick overview for those of you who like maps. This is a map we're really proud of. We have every state in the country covered, in addition to Puerto Rico and the Northern Marianas Islands. And these little yellow dots are where the grantees are located, although the coverage is much, much wider. So many of these serve several counties, and then the partnerships that they have serve even wider areas. So next slide, please. And so our grantees really are trusted messengers. These are folks that really know their communities at a very local level, understand the people they're serving. Actually, that we have more than 148 grantees now. Apologize that this slide was a little bit older than I realized. Just hit the over 200 mark in grantees, but including the partnerships that they have, well over 1,600 organizations in this collaborative. So we're really proud of it. And the collaborative includes area agencies on aging, Title VI Native American aging programs, CILS, which are Centers for Independent Living, ADRCs, No Wrong Doors, lots of community-based organizations, all nonprofit that are doing this incredible work for our communities and our caregivers and our families and our older adults and people with disabilities. So next slide, please. And these are just a couple of slides with some examples, people of the creativity and just really taking into account how important it is, to put on vaccine clinics that people want to go to and are not afraid of going to, and it can infuse some fun or lower some anxiety at these clinics. So this is a karaoke night at one of our facilities, one of our communities, a pride parade. One of our grantees offered theater tickets. I believe this was down in Austin, Texas, to go see Beauty and the Beast if they got a vaccine. So really just fun, creative, really community focused clinics. And that addresses so much more. Getting a vaccine is the ultimate goal of this collaborative, but addressing all of the other things in tandem with these vaccines is what's making this so wonderful. So I just love seeing all these new partnerships, really. Next slide. I think I have one more slide yeah. So this was a fun one too. This is an example of one of our mobile health clinics that came out. This one was a CVS clinic. CVS is often partners with our grantees, but so does Walgreens. There are grocery store pharmacies, independent pharmacists, consultant pharmacists, federally qualified health centers. There are just partnerships galore out there, depending on where people live and what's in their local community as far as getting vaccines. So next slide. And we're really excited because as a national resource, we want to help older adults, people with disabilities, caregivers, their families, all of this, stay healthy by getting vaccinated. So we have a national campaign as part of the ADVC, and it's You've Got This.usaging.org. And I hope that maybe some of you might have seen some of the advertisements. We have television, radio, PSAs. I think we're getting some really good airplay. I mean, it's in the tens of millions of views now, and we've just started this. So, but if you go to this website, it's really great. You can just type in your city, your zip code, and you'll be able to find one of our grantees. So it'll map it out for you, give you their website, give you a phone number. You can also call. We're integrated into our national call center, the Elder Care Locator. and disability information access lines that are housed at US Aging, all integrated. So you can call one of those and they can help really walk you through where you are, who you need to be in contact with, and how you can get a vaccine through us. So, and the next slide, I have embedded a 15-second commercial, but I don't know if it'll play or not. I should have op checked this. If it doesn't, this is at least a screenshot of that. So if you see this kind of logo and the yougotthis.usaging.org advertisement when you're watching TV or listening to the radio, that's us. And I think that wraps up my presentation, I believe. Next slide on there. Oh, it did. I don't know if the videos. Oh, so the video will at least play. But I hope you'll check out this website. It's got really great information on it. And yeah, I think we have questions at the end. So thank you very much.
Thank you so much, Jennifer. And definitely encourage everyone to check out the website. I went around and it was great to see the different social media like campaigns and like images, and I got to watch the commercial. So please check it out if you can. So up next, I want to present our last set of speakers, Robin Troutman, Interim Executive Director of the National Association of Councils on Developmental Disabilities, NACDD, and Renee Manfredi, former Hawaii Disability Council member and Special Olympics athlete. Robin joined NACDD in November of 2015. Previously, she has served in a number of administrative and operational roles for both the for-profit and nonprofit sector. She specializes in organizational management and events management, and Robin holds a bachelor's degree in political science and a master's degree in management with a focus on nonprofit management. And Renee has been a Special Olympics athlete for over 16 years. She is a multi-sport athlete, a health messenger, Toastmaster, Sergeant Shriver International Global Messenger, and singer. Renee currently works as a consultant for the leadership and organizational development and health teams at the Special Olympics International. She is a passionate advocate for individuals with intellectual and developmental disabilities and is determined to empower others in their advocacy journey through public speaking, education, and support. Renee believes in helping everyone find their voice. She says, when all of our voices are heard, we have the framework for an inclusive world. With that, I turn it over to both of you, Robin and Renee.
Thank you so much, Yadira, and to everyone for joining us today. We're so excited to be here. I also want to give a big thanks to Renee for joining us. When she moved out of Hawaii, we were concerned we wouldn't get to work with her again, but we're so thrilled that she was able to join us today. And just for logistics, it seems that the ASL interpreter is in the main room and not on the interpreter channel. So if you go back into, if you go back into the main room, you should be all set to see the interpreter. So thank you. And I'll go ahead and get started. So again, thank you. The National Association of Councils on Developmental Disabilities, or NACDD, and our 56 member councils work across the United States and its territories to support programs that promote self-determination, integration, and inclusion for all people in the United States with intellectual and developmental disabilities. We know that the COVID-19 pandemic had altered the lives of people with intellectual and developmental disabilities and their families. Individual and public health, education, and employment opportunities and community health living have drastically changed. For many people with disabilities, including IDD, they and their families or caregivers may be feeling anxious or unsure about the vaccine and its safety, as well as the flu vaccine or other health decisions. And all decisions related to your health should be based on facts and trusted sources. Give me one quick second. I'm going to let Renee speak real quick.
Thank you, Robin. Thank you so much, everyone, for letting me come here. And it's just so awesome to meet all of you here. I will start with my story. In my work with health issues around the world, I see how very fortunate that we are in the US to be able to receive a vaccine. There are places abroad where people walk 3 days and wait for their turn to receive a vaccine. I have all of my other vaccines, measles, mumps, tetanus, and many others. So I truly believe in being vaccinated. When COVID-19 began, I lived in Hawaii at the time. Because I have no pre-existing health issues and I do not receive home and community-based services, I had to wait to get my vaccine because I was not considered a priority category. I wanted to be covered by my vaccine, and I didn't want to jeopardize anyone's health. So it was very important to me to get my vaccine. Not knowing how long our COVID restrictions would last, I also didn't want to jeopardize any of my friends who may have had health issues. As it turns out, I didn't see many of them for a long time, but we didn't know that at the time. I lived with my parents, and my father was required by the military to get the vaccine, and my mom chose to get hers when I could get mine. Being military, we received our vaccines at a military treatment facility and went as soon as we could. Once the vaccines began to be administered in Hawaii, the wait times went quickly. In June of 2021, my family moved from the land of aloha to the Lone Star State of Texas. The access here was very easy to receive my booster and follow up on vaccines. I did not have to wait, and my doctors recommended what I needed. This May, the CDC announced that starting May 11th, 2023, COVID-19 wouldn't be classified as a public health emergency anymore. However, you can still find all the necessary tools like updated COVID-19 vaccine information, treatments, and available testing. Special Olympics created a useful toolkit to assist you in understanding COVID-19. Our education toolkit empowers athletes, caregivers, and families with knowledge about COVID-19 and vaccinations. You can find these on our website. I believe the link is in the chat. Thank you so much. Mahalo nui loa. Robin?
Thank you, Renee, and thank you so much for sharing your story. I apologize for my distraction. I'm actually at an appointment with my oldest son, taking care of some health issues. So it is so important to manage your health. Okay. As we've heard today, vaccines have greatly reduced diseases that once routinely harmed or killed babies, children, and adults. People all over the world, including in the United States, still become seriously ill from diseases that vaccines can help prevent. It is important that you stay up to date on those recommended vaccines that even Renee just mentioned. The protection some vaccines provide can fade over time, and you might need additional vaccine doses or boosters to maintain that protection. And that is why we recommend getting your additional COVID vaccine boosters, but also your flu vaccine every year. And then with this year, the rise in RSV, which is a really serious respiratory illness, we recommend the CDC and health professionals recommend getting that vaccine as well. Vaccination against COVID-19, flu, and RSV is important so that everyone can safely get back to living their lives and being part of their community again. As our earlier speakers mentioned, it's holiday time. We want to be able to see our families, but we want to make sure we're not putting them in danger to do so. One item that Jennifer had mentioned was U.S. Aging's Disability Information and Access Line, or DIAL, D-I-A-L. This is funded by the U.S. Administration for Community Living and the Centers for Disease Control and Prevention, and NACDD is proud to be a partner with U.S. Aging and a number of other organizations to provide this service to people with disabilities to find accurate information to receiving vaccines and other information to live their best life. The Dial hotline assists people with disabilities to get vaccinated by providing assistance finding COVID-19 vaccination sites, determining whether in-home vaccination is available, educating callers about general COVID-19 vaccine information and other vaccine information, and also finding ways to overcome both physical and systemic barriers to accessing vaccines. The Dial network also helps people with disabilities identify, locate, and access community services and supports. There is so much information out there, and it is so important to find the right, accurate information. And we recommend looking to the Dial network to find that information. Also, NACDD has our Get Out the Vaccine website. I will put that in the chat. It is www.getoutthevaccine.org. And again, we want to thank you for inviting us to participate, and I will give it back to Yadira.
Thank you so much, Robin and Renee. Renee, thank you so much for sharing your story and how it's important. It was important for you to get your vaccine initially and get your boosters and stay up to date with your vaccinations. And as Robin mentioned, we are in flu season. It's so important to protect ourselves, to protect those that we care for and our communities. So with that, I am gonna, I think we're ready for question and answer. I just want to point out that Robin and others have been dropping in the links to all of these resources. So please check them out, save them in your browser. And to get us started, I don't see any questions yet, but I have a few for our panelists to get us started. And let's go with you, Lindsay. Why might people be getting billed or seeing costs associated with COVID-19 vaccines, despite the fact that they should be covered?
Yeah, thank you for the question, because I think that, one person goes and gets, there's a cost to it or fee, and they go and tell their friends and family that it's not free. And I think it's really important to underscore that they are required by law to be covered no matter your insurance. But this is a shift, right? Everything's shifting over. So there can be complications or challenges to the changes. So hopefully it's something that people will start to see less and less. But, if you're on some of these plans, you might just look to make sure you're at an in-network provider. It's the right provider. If you're looking through the Bridge program, the CDC's program, it could depend on the pharmacy you're at. So it's just making sure that you're in the right place to get it. And again, a great place to find out is vaccines.gov. But also I mentioned that COVID Vaccine Education and Equity Project. We have a really great one-pager called How Are COVID Vaccines Covered by Insurance? And you can go to covidvaccineproject.org. I'll drop those into the chat. But I think the big thing is to ask in advance so there's no surprises, and know that you shouldn't be charged anything. And so if you are, you might need to call and check in with someone, but you should be able to find it for free.
Thank you so much for that, Lindsay. Okay, I see a question here, and I'm going to open it up to any of the panelists, and it's, what if you belong to another specialized community, such as immunocompromised? Where can I find information on this topic?
This is Robin. I will say definitely reach out to the CDC. They are your best information for information related to the immunocompromised, but I think any of our organizations also have a number of those resources on our own sites, but I would check out the CDC resources and then of course vaccines.gov.
Thank you for that, Robin. Okay. Let's go with the next question. Jennifer, you touched a bit on this on your presentation. Can you talk to us about grantees' efforts to engage and build trust? Well, you talked about grantees' efforts to engage and build trust among socially, culturally, and economically diverse communities. Can you talk a little bit more about any efforts or lessons learned from grantees working with caregivers to someone in a rural, living in a rural area in the country?
Sure. Great question. One of the, not surprisingly, challenges in rural communities is transportation. There's just more miles typically to travel, and typically a lot fewer, public transportation systems. So people rely on, some interesting partnerships with, just to get to vaccination clinics, or to provide in-home vaccinations. So that's a challenge, and it's a challenge that's been overcome a lot with some really great, thoughtful, creative partnerships out there, leveraging anything from, renting vans and cars to partnering with, a Center for Independent Living who might have a van, things like that. So there's really great stuff going on in that arena. Also, one of the challenges in rural areas has been just a lack of brick and mortar, your typical pharmacies, Walgreens, CVS. There's not one on every corner. They tend to be, more local pharmacists and pharmacies, and they again have to travel great distances to get to those pharmacies. So mobile clinics, we had one grantee, their idea, I don't know if they've done it yet, but they're renting an RV, and they're gonna create their own mobile vaccine clinic with an RV. So this is the kind of stuff I just love, what humans can accomplish when they set their mind to it and they have a goal. So yeah, so that's, I guess those were the two I would call out.
Yeah, thank you for sharing that. Yeah, innovation, and how do we get the information and the vaccines to the people where they need them? I think it was Lindsay who you said, get it to the right people at the right moment where they need them. So, okay. And my last question is either for you, Robin, or Renee. Lindsay outlined many of the challenges around getting accurate and reliable information about COVID and the COVID vaccine. I'm curious if you could talk a little bit more about the trends or topics that tend to come up in the disability community among caregivers and care partners. So any of you either of you, if you want to take this question on. Go ahead, Renee.
I actually find that many people are not as concerned as they were about getting vaccinated. Maybe it's because they don't have all the information that was just shared, how it's still important, how people who get the vaccine fare better, how serious COVID can still be if untreated. Like Jennifer said, now that we live in Texas, we are driving a lot. The little country towns don't have a Walgreens or CVS. We have to go to like big cities for that.
Mm-hmm. Yeah.
These can be issues.
For sure, for sure. Thank you for outlining those for us. I think I don't see any more questions coming up here. So I can get us wrapped up. Thank you so much for speaking today. At NAC, we look forward to continue to raising awareness about the importance of the COVID-19 vaccine and its availability. We know, and you've mentioned, our speakers have said that the COVID vaccine can help us protect us from getting sick, can limit the spread of the virus. We need it to stay healthy ourselves and to keep our families and our community healthy. As well as not only the COVID-19 vaccine, but the flu and the RSV vaccine, which Robin mentioned. We also know the importance and value of engaging family caregivers in our collective efforts to stay healthy. So thank you, Jennifer, for highlighting the different innovation and projects that are happening across the country to get the vaccines to individuals, caregivers, and communities. I want to thank our supporters at Pfizer. Again, thank you, all of the speakers, for sharing your professional and/or personal experiences with us regarding the COVID-19 vaccine. A special thank you to Robin and NACDD for making ASL interpretation possible for us. As I mentioned, this is our first time, so thank you for coming along the ride with us. I know that we switched the format, and it was to make sure that everyone was able to take advantage of this ASL interpreter. So Thank you for spending time with us this afternoon. I encourage you again to check out the links that the websites that were mentioned by all of our presenters. The links were included in the chat, and to save them and reference them for later, but also to share them with others in your network. And this webinar will be in NAC's YouTube channel within a few days. And so please check it out and share with others who might find this information useful and would benefit from this information. Thank you all so much.
Thank you.